Hi, I'm Valerie, a registered nurse and health educator. I recently started adding these wellness research brief videos to my channel as a way to share important new studies and help translate them into plain, understandable language. My goal is to show you not just what the research says, but how to apply it in real life and use it to improve your health, lower your risk of disease, and make more informed decisions about your care. A new study showed up in my inbox late last week, and I knew I wanted to get it out in front of you as soon as possible because it shows that many heart attacks in younger adults, and especially those that occur in younger women, happen for reasons that most people, including many healthcare providers, don't expect. This study, published in the Journal of the American College of Cardiology, looked at more than 2,700 people aged 65 and younger who had a heart attack. And while many people tend to associate heart attacks with clogged arteries and having high cholesterol for years, the researchers found something different. They found that a surprising number of heart attacks, especially in women under 65, were caused by non-atherosclerotic mechanisms or by means other than plaque building up on the coronary artery walls. And one of the most important causes is spontaneous coronary artery dissection, or SCAD. This caught my attention because SCAD tends to affect people who don't fit that typical heart attack risk profile and can blindside those who are doing all the right things. So it is something that is usually unexpected, and not just by patients, but by doctors too. In this video, I will be talking about what SCAD actually is and how it happens, what this new study found about its role in younger people having heart attacks, what signs to watch for even if you think you are not at risk, and why knowing this information could change how you advocate for your health or the health of someone you love. So let's start by talking about what SCAD actually is and why it so often goes missed. SCAD is when a coronary artery, so that is one of the vessels that supplies blood to the heart, develops a tear in its inner wall. When that happens, blood can collect between the layers of the artery wall, pushing them apart and causing a split between the two layers of the artery wall. The blood trapped between the two layers can then clot. This is called intramural hematoma. This narrows or blocks the passageway for blood, reducing oxygen delivery to the heart muscle, which can lead to a heart attack. Because there is no major plaque buildup or clot, SCAD can be easy to miss, even in the emergency room. It often does not look like a typical heart attack on imaging. More than half of SCAD cases in this study were misclassified at the time of the event, either as a heart attack with non-obstructed arteries or as a standard atherosclerotic disease. And most people who experience SCAD are blindsided by it. They are often younger, active, and don't have the usual warning signs or typical risk factors for a heart attack that puts them on their doctor's radar. In fact, in studies of SCAD patients, a significant majority reported one or no traditional risk factors at all. Hormonal influences, including periods of change in estrogen levels, are often observed along with SCAD. So we do sometimes see it around pregnancy. Also, underlying artery wall conditions are seen along with it. And also, physical or emotional stress sometimes precedes episodes, although SCAD can also occur without any clear trigger. SCAD does not always present with warning signs that stand out. Some people experience chest pain or shortness of breath, just like with any other heart attack. Others can have milder symptoms that are dismissed or attributed to less serious causes. Because SCAD is less common and less talked about, symptoms in those who look healthy or are physically active are sometimes misinterpreted. That is part of why this condition often gets discovered only after a heart attack. So the findings of this new study were a bit enlightening to me, as I never really thought of SCAD as one of the leading causes of heart attacks in any group of people. This study included more than 27 heart attack patients aged 65 or younger, and researchers discovered that a notable number of heart attacks in this group were not caused by the usual culprit, which is plaque buildup in the arteries, but by processes such as SCAD. And what really stood out to me was how much more frequently SCAD occurred in women than in men. It accounts for 11% of heart attacks in women under 65, compared to less than 1% in men. So this study confirmed that spontaneous coronary artery dissection is a real and under-recognized cause of heart attacks in women, who often do not have the typical risk factors like high cholesterol or long-standing high blood pressure. And because it presents differently than the classic heart attack, it is often missed or misdiagnosed, especially in younger women. This study confirms what other SCAD studies have suggested, that it is not as rare as many people think. It is not always easy to predict, and it is especially relevant for younger women experiencing heart attack symptoms. For people who think they might not be at risk of a heart attack, having some basic knowledge about SCAD could make a difference in seeking care early or pushing for the right diagnostic tests. One of the most challenging aspects of SCAD is that it does not always come with the classic risk factors that we associate with heart attacks. Many of those affected, especially women, don't have high blood pressure, don't have high cholesterol, don't have diabetes, they don't have that history of smoking. Some are even athletes. Many are new mothers. Many are otherwise very healthy and very active. This is a big part of what makes SCAD so hard to spot ahead of time. There are some recognized risk factors, including fibromuscular dysplasia, which is a condition that affects artery structure, some connective tissue disorders, and extreme emotional or physical stress. Hormonal shifts, such as those occurring during or shortly after pregnancy, may also play a role. But in many cases, SCAD appears with no clear warning. In fact, the study found that a sizable portion of younger women who had SCAD-related heart attacks had none of the traditional cardiovascular risk factors at all. Just as importantly, the signs of a heart attack in women can sometimes be different than in men. While chest pain is still the most common symptom, and other classic symptoms like the shortness of breath, the sweating, the nausea, or the pain radiating to the arm, back, or jaw, those do still occur in women. But women are also more likely to experience more subtle signs like fatigue, mild shortness of breath that can feel more like anxiety, nausea, dizziness, lesser back or jaw pain, or they can just feel a general feeling of unease. These symptoms can be mistaken for something else or brushed off, especially in someone who is otherwise healthy and doesn't fit that typical heart attack profile. But knowing how these signs can show up differently is key to recognizing when something could be serious. Brushing off these symptoms can result in a delay in recognizing SCAD that can be dangerous. So the key takeaway here is that if you or someone you love ever experience symptoms that feel like a heart attack, regardless of your age or your fitness level or your health history, it is still important to take them seriously and seek medical attention immediately. Early evaluation and proper imaging can make a huge difference in getting an accurate diagnosis. SCAD may not be as well known as other causes of heart attacks, but it can still have a major impact on those affected by it. Increasing your awareness is the first step in protecting yourself or someone you care about. This study helps to highlight that not all heart attacks stem from clogged arteries, and not everyone who has one fits into the typical risk profile. In fact, when it comes to SCAD, the person at risk probably looks nothing like the stereotypical heart patient. And that is why I wanted to get this research out there quickly, because the more that we understand these lesser known conditions, the more that we can push for appropriate care, earlier diagnosis, and better outcomes. It is important to have some knowledge that conditions like spontaneous coronary artery dissection, or SCAD, exists, and it can affect women who are otherwise healthy. Knowing this helps you become a more informed patient, a better advocate for yourself, and someone who can help spread awareness to others. If you found this video helpful, please give it a like and consider subscribing to my channel. I post regular health and wellness content grounded in evidence, free from hype, and designed to help you make informed decisions that support long-term wellness. If you would like to support my mission, you can do that by clicking the thanks button below this video and making a small donation. And if you are looking for personalized support, I also offer 20-minute wellness consultation calls. These are one-on-one sessions where we can talk through your specific health concerns like heart health, joint issues, chronic disease prevention or reversal, or the effects of trauma on long-term health. You can find the link to book a session in the video description. Most importantly, please share this video with someone you care about. You could save a life without even realizing it. Thank you so much for watching, and please take good care of yourself.